Right, so I work at Nelson Mandela University at the medical school, and my topic for today is a question. Is the current medical school environment conducive to interprofessional education and collaboration in gender-affirming healthcare? And it's from a narrative inquiry, which is part of my PhD work. So the background: it's evident in the literature that health profession students generally are not adequately prepared to provide gender-affirming healthcare. The environment in which students learn plays a significant role, and this has been referred to as hidden curricula, as has been referred to earlier. So the aim of this research was to explore how medical curriculum change could enable the professional identity formation of a gender-affirming practitioner. Professional identity formation is the transformative journey through which one integrates the knowledge, skills, values, and behaviors of a competent health professional with one's own unique identity and core values. And then we all know what gender-affirming healthcare is. Interprofessional education and collaborative practice, that is the theme of today's symposium, happens when two or more professions learn about, from, or with each other to enable effective collaboration and improve health outcomes. And collaborative practice is when multiple health workers from different backgrounds provide comprehensive services, working with patients, families, carers, and communities to deliver the highest quality of care across settings. So you want to get to that sweet spot in the middle where we currently have a fragmented health system, but if we can do interprofessional education so that our graduates are collaborative practice ready to then work together and strengthen the health system, that we can get improved health outcomes. So professional identity formation has been, a lot is written about it in medical education. And you basically come into medical school with existing personal identities, what you bring with you, and then you are socialized through a community of practice to the professional identity that you become. And I use this as a framework to look at becoming a gender-affirming practitioner. There's multiple factors that play a role in this socialization process. And for today, I'm going to focus on the learning environment, acknowledging that there's many other factors as well that I explore in my study: role models, clinical, non-clinical experiences, and then the formal teaching that plays a role as well. But the learning environment is what we'll focus on for the next few minutes. So it was case study design and narrative inquiry. I did narrative interviews with the practitioners and students and used the theoretical lens of professional identity formation. So what did I find? Participants described the medical school environment as conservative and hierarchical, with experiences of homophobia, transphobia, and racism. In this environment, the biopsychosocial approach is not valued. Students describe a power dynamic where they are scared to speak out, even when clients are misgendered, because of the hierarchy. And I'm going to share some quotes with you. One of the practitioners describes medical school culture as producing doctors who think they know what is best for the patient. This she contrasts with gender-affirming healthcare, where the patient is in charge. I would say medical school created demigods, you know, where you go out believing you know what is best for the patient. You're going to tell the patient, do this or this will happen. You know, take this 3 times a day or you will die, or something like that. Now with gender-affirming health, it forces you to be a different practitioner, even to just your other patients, you know, to say the patient is in control or in charge of their own healthcare and well-being. You're there to listen, understand, and then offer different options on how the patient can be better or be well. The environment in which we want to imagine curriculum change is described by B, who is a student, as conservative, with senior clinicians and students making assumptions about queer students and misogyny and homophobia present. B also describes a feeling of powerlessness. The way that people experience gender, depending on the assumptions and perceptions that people make about you, is so different. And like interaction with particular senior clinicians or your classmates, the way people make assumptions. Some of my friends who are queer people have had assumptions made about them by other classmates You know, vile rumors started. Assumptions get made about them by clinicians, and we think about, like, what is safety? What does that look like? The interaction, sometimes you watch and you see and you're like, oh, this is misogyny playing out, or this is just like homophobia playing out. And you also feel like, sigh, what am I going to do? Another student said, I think in first year, it's very much like you're in med school, now you're at the bottom of the food chain. Just kind of go through it, it's fine. You don't want to step on people's toes. Don't be loud about your opinions. HM, a student who identifies as non-binary, describes the culture at medical school as not supportive, with underlying racial tensions and microaggressions. So, for example, in hospital, I've heard stories of people who maybe go by different pronouns, not necessarily being acknowledged by doctors in the hospital when on ward rounds. There seems to be a lot of unspoken microaggressions. And there have been sort of sexist comments thrown around in the hospital setting. And as a student, you're sometimes not quite sure how much to ignore, how much to take, because these people are responsible for your marks after all. So I think that's the type of power dynamic that I have to deal with. For interprofessional education and collaboration to happen, an environment is required where colleagues from different disciplines, students, as well as clients are respected. And the competencies for IPECP is role clarification, team functioning, interprofessional communication, patient, client, family, and community-centered care, interpersonal conflict resolution, and collaborative leadership. And for gender-affirming healthcare to happen, we need to be more affirming of our clients, but also of our colleagues in the multidisciplinary team. So in conclusion, the environment described in the study does not appear to be conducive to IPECP. And the recommendations is that faculties of health sciences pay attention to the environment in which students learn. We need to focus on staff development for both gender-affirming healthcare and interprofessional education and collaborative practice. And from a critical pedagogy perspective, we need to pay attention to power dynamics between the student and educator, the client and health professional, and also between doctors and other health professionals. And we should never stop dreaming of a world where all clients and colleagues will be affirmed and respected. Thank you.